With every passing day, Mr. President, the American people become more and more perplexed about the Democratic plan for health care, and they like it less and less. Americans thought reform meant lowering costs. This bill actually raises costs. Americans thought reform meant helping the economy. This bill actually makes it worse. Americans thought reform meant strengthening Medicare. This bill raids it to create a new government program that will have the same problems that Medicare does. Americans wanted reform. What they're getting is the opposite. More spending, more debt, more burdens on families and businesses already struggling just to get by. One of the biggest sources of money to pay for this experiment is Medicare. This bill cuts Medicare Advantage by $120 billion. It cuts hospitals by $135 billion. It cuts home health care by $42 billion. It cuts nursing homes by $15 billion, and it cuts hospice by $8 billion. Reform shouldn't come at the expense of seniors, and the McCain Amendment guarantees that it wouldn't. The McCain Amendment would send this bill back to the Finance Committee with instructions to remove the language that cuts Medicare. The McCain Amendment also says that any funds generated from rooting out waste, fraud, and abuse should be used to strengthen Medicare, not to create an entirely new government program. A vote in favor of the McCain Amendment is a vote to protect Medicare. Let me say that again, Mr. President. A vote in favor of the McCain Amendment is a vote to protect Medicare. A vote against the McCain Amendment is a vote to raid this vital program in order to create another one for an entirely new group of Americans. So a vote against the McCain Amendment is a vote to take money out of Medicare to create a program for an entirely different set of Americans. A vote against the McCain Amendment is a vote against our seniors, and it's a vote against real health care reform. Mr. President, I yield the floor.
Time remains on the
13 and a half minutes.
I'll yield myself 5 minutes, if I may. Mr. President, I just want to come back, if I can. I'm going to put up, do you have those charts with you? Let me just put up these charts. I say this respectfully because I genuinely believe that people across the spectrum here would like to see some reform of the health care system. The question is whether or not the proposal that has been laid before us here by the Finance Committee and the Health Committee achieves reform, and whether or not the ideas we bring to the table are actually going to achieve lower costs, greater access, improve the quality of health care. We believe very firmly and strongly that it does, and outside observers of this process who have no political agenda whatsoever, but really making determinations to whether or not the goals that we have sought in this legislation achieve the desired results are there or not. It is the conclusion of the major organizations that make these determinations that, in fact, we have done exactly what we said we were set out to do. But I want to point out, because I think it's important when I hear the arguments from our friends on the other side about their deep concerns about Medicare, it's very, very important that they understand that that over the last number of years we've seen quite the opposite reaction when it comes to the Medicare program in our nation. Going back, if you will, to 1995, when our friends took over the control of both this body and the other body and began a process. The then Speaker of the House, Newt Gingrich, announced to the world that basically he was prepared to let Medicare, and I quote him, wither on the vine. I mean, that's not ancient history. That's not 1965 when the Medicare program was adopted. That's merely 15 years ago, 14 years ago, when the other party, for the first time in 40 years, became the dominant party here in Congress. One of the first statements from the leadership of that party was to let this program wither on the vine. Now, again, that's one person. It was the Speaker, the leader of the revolution that produced the results electorally in 1994. But I think it's important as a backdrop, when we hear the debate about Medicare, it's important to have some history of where the parties have been on this issue, generally speaking. So in 1995, we begin with that as a backdrop. In 1997, 2 years later, it happened again. In 1997, if I may, just pointing out, here were the proposals. In 1997, Medicare's spending as proposed in the Republican Balanced Budget Act of that year were twice of what we're talking about in the savings in this bill. A 12.4% reduction in Medicare benefits in 1997. And of course, in the last budget submitted by President Bush last year, and again, I think, it's reflective of where things were. This is a year ago. It's not 14 years ago, or not 1997, but 2009, the Bush administration, in its submission of its budget, proposed a $481 billion reduction in Medicare benefits. That was not in the context of a health care reform bill. That was just in the context of a budget proposal. Here we're talking about savings by reducing costs in hospitals and other providers as a way of strengthening Medicare, providing more benefits to the beneficiaries themselves in things like prescription drugs, as well as in screenings and early prevention efforts, which are included in our bill, which have been identified, of course, by AARP and the Commission to Preserve and Protect Social Security and Medicare. They have analyzed our proposals and have suggested that we do just that. We strengthen Medicare and we preserve those benefits. Our bill saves $380 billion in order to strengthen the Medicare proposal, improves the quality of health care for seniors as part of our comprehensive reform. In fact, Senator Coburn's Patient Choice Act actually imposes a $40 billion more cuts in Medicare Advantage than our bill does. So I find it somewhat intriguing that for those who are arguing for the Coburn proposal as an alternative and yet simultaneously suggest we ought not to do anything to Medicare Advantage, have not read the Coburn bill, because he cuts $40 billion more out of Medicare Advantage than what we do in our legislation as proposed. Let me just quote, if I can, in conclusion, from the National Committee to Preserve Social Security and Medicare. Again, not a partisan organization. Their sole mission is to see to it that Social Security and Medicare will be there for the people it was intended to support. In a letter sent to every United States Senator yesterday from the Commission, let me quote exactly from them. Not a single penny of the savings in the Senate bill, the bill now before us, Mr. President, will come out of the pockets of beneficiaries in the traditional Medicare program. The Medicare savings included in the House bill, the Patient Protection Affordable Care Act, will positively impact millions of Medicare beneficiaries by slowing the rate of increase in out-of-pocket costs, improving benefits, and it will extend the solvency of the Medicare Trust Fund by 5 years. To us, this is a win-win for seniors and the Medicare program, end of quote. So we can hear all the partisan debate back and forth as to what this bill does. But if you're interested in what those organizations whose sole mission is to analyze whether or not beneficiaries are going to be advantaged or disadvantaged by what's being proposed here, they categorically, unequivocally suggest that the McCain Amendment would do just the opposite of what our bill does. It would roll the clock back, damage seniors terribly by reducing or eliminating the provisions we've included in our bill, and they strongly support what the Finance Committee wrote in its bill that is now presented to all of us here as a way to strengthen and preserve the Medicare program. And so I say to my colleagues and to the others, you can listen to this partisan debate back and forth as to whether or not you want to believe the Democrats or believe the Republicans. But I would suggest, if you're not clear who to believe in this, listen to the organizations whose job it is to protect this program, with whom we have worked very closely to determine that we would not in any way reduce those guaranteed benefits that Senator Baucus just addressed in his remarks. That is what we do. That is why this bill is a good bill and deserving of our support. And I urge our colleagues to reject the McCain Amendment. Mr. President, I yield the floor.